Fiscal year 2019 to 2020 was a challenging year for PBSP, its member companies, partners and donors, and the whole world. The last quarter of 2019 was marked with a strong earthquake that affected thousands in Mindanao. In January of 2020, Taal Volcano shook Batangas and nearby provinces, leaving multiple damages to property and gravely affected the lives of people in Taal and nearby provinces. In March, COVID-19 struck the Philippines. No one was spared from the pandemic. Quarantine measures were put in place. Economic activities were affected and businesses halted operations. Communities were put at risk and we lost many of our medical frontliners, the fallen heroes. But despite all these, PBSP rose up to the challenge to continue its mission. We were there when people needed help. In October 2019, we mobilized and raised funds for the affected families in the Mindanao earthquake, the hashtag SOS I Mindanao. We rallied our members and partners to assist families in the aftermath of the Taal eruption, the hashtag United for Taal, in January of 2020. In February, we turned over a mobile water treatment system to the Armed Forces of the Philippines in Zamboanga City for our soldiers and the communities in Sulu. We continued to assist disadvantaged youth and displaced workers through our near-hire training project. Graduates were eventually employed after completing the training. Virtualahan, as our partner, also trained displaced workers, PWDs, and drug dependents nationwide. The work continues with the help of our partners and local government units in the prevention of the spread of COVID-19 in areas affected by the earthquake in Mindanao. We have completed the full implementation of RISE CSO LGU. The interventions have contributed to the development of tools for LGUs to increase their resource and revenue generation, specifically through better tax collection, closer collaboration with the private sector, as well as economic and/or tourism projects. In the Bangsamoro region, we continued the distribution of Marawi storybooks for our learners and teachers in Marawi and Lanao del Sur divisions. Aside from the books, the teachers were oriented to utilize the books in teaching English and mother tongue and provide psychosocial support to children to help them process their experiences and manage their emotions. We continue to promote job opportunities and community involvement of young people and women in Marawi and Zamboanga by strengthening their professional skills, civic commitment, and employability. The project that covers 3 senior high schools and ALS in Zamboanga and 4 senior high schools in Marawi conducted series of capacity building workshops and is currently implementing support interventions for in-school, the senior high school learners and teachers, youth not in school, post-training support for in-school and NEED, industry academic collaboration, and displaced women in Marawi. In August, we launched PRISM in Butig, Lanao del Sur and Parang, Maguindanao to contribute in achieving peaceful, secure, and resilient conflict communities by empowering the stakeholders and the LGU to practice participatory and inclusive governance. The project, built on the insights and gains of the Community Policing Project, enhanced local governance around safety, security, and justice matters, including resilience to conflict. A baseline study on justice, peace, and security was conducted to inform future interventions from the private and public sector. Various peace and security stakeholders were gathered to identify the roles of different institutions in enhancing peace and security measures in the communities and the capacity needs of the local Peace and Order Councils or LPOC. For TB services provision, we have 6,565 MDR-TB cases notified and attended to, and has successfully treated 88% of the 470,842 TB cases in all forms. Due to the challenges brought about by the community quarantine imposed in March of 2020, we have recorded a significant drop in cases notification, but the treatment did not stop. Tuloy ang gamutan despite COVID-19 through our home-based treatment and medication to secure a safe and uninterrupted provision of TB services in the country through the PBSP Access TB in partnership with the DOH NTP and the Global Fund. For our new projects, we begun strengthening systems towards effective youth development in Lanao del Sur to contribute to the empowerment of youth through equitable access to education and training, employment and enterprise opportunities by strengthening relevant systems of the Lanao del Sur provincial government to improve the delivery of holistic programs and services to the youth through participatory planning and policy development, information management, and enhanced coordination mechanisms. We also launched the Women's Rights Action and Advocacy Project, or WRAAP. The project, that is national in scope, involves strengthening the capacity of women's rights organizations and coalitions in the areas of organizational development, administration and finance, project management, programming, and sustainability. PBSP continues to contribute to the reduction of violence against women, girls, and children, early and forced marriage in Lanao del Sur and Maguindanao through the creating spaces to take action on violence against women and girls. The project continued to support women and young mothers in sustaining their micro-enterprises along dressmaking, sewing, weaving, and food processing. Despite the limitations in mobility due to the pandemic, the project was able to accomplish most of its targets for its final year of implementation. For COVID-19 assistance, we worked with the Bayanihan Musikahan Coalition in March of 2020 to help raise funds for the relief operations in Metro Manila and Cebu and the procurement and distribution of PPEs and hygiene kits for our medical frontliners and COVID-19 patients. We also launched the Eye Wash Project to help slow down the spread of COVID-19 by providing our communities with hand washing facilities, hand soap, and disinfectants. The Global Fund also allocated a huge grant for COVID-19 response to help address the containment of the spread of the disease and mitigate challenges in the TB services provision. PBSP Access TB assisted the DOH NTP in developing the new adaptive plan for the new normal on TB services provision. Part of the work is to consistently monitor activities to ensure proper implementation of the initiative in all hospitals and facilities nationwide. Truly, despite the challenges, our work continues to bring the services to our communities and beneficiaries. To our member companies, partners, and donors, maraming salamat po. As we move towards the coming years, let us continue to work together to achieve a better world for PBSP and for all.